Hello and welcome everyone today for today's webinar, SOP that fail inspection even when approved. Very interesting topic, and over the 30 minutes, we are going to look at one of the most frustrating experiences in regulated pharmaceutical environment, that you have a standard operating procedure which has been drafted, reviewed, approved, and signed off through your quality system. And even when an inspector walks in, that very procedure becomes the source of finding. So this module is written for the whole industry: quality assurance, quality control, manufacturing, regulatory affairs, pharmacovigilance, supply chain, and good distribution practice, clinical, and also research and development. Whatever your function you own, follow, or depend on SOP, so this applies directly to you. Throughout, I will define terms as we go and point to the specific regulations at each point. So let's begin. Let's begin by looking at what you will be able to do by the end of this webinar. So by the end of this webinar, you will be able to explain in simplest and easy way why a procedure that has been fully approved can still fail in inspection. You will be able to identify the 5 recurring causes of SOP related findings that we see again and again across every region and every function. You will learn to recognize that we call the practice procedure gap. So, which is a difference between what the document says and what actually happens on the floor. And most importantly, how an inspector uncovers that gap in in a matter of minutes, basically. You will learn to spot unenforceable wordings, weak wordings, before it even reaches the approval, because a lot of findings are literally written into the SOP at the drafting stage. We will connect the SOP failures with the data integrity principles, ALCOA plus principles, which are now central to how regulators think about documentation. And finally, you will leave with a practical self-check you can apply to your procedures on Monday morning before we dive into the causes. Let's frame the central paradox. So here is the paradox at the heart of a session. Approval feels like the finishing line. Someone drafted the procedure, a subject matter expert reviewed it, quality assurance authorized it, and it carries signatures and an effective date. But approval only confirms with one thing: that the document went through your internal authorization process. The approval does not confirm that the procedure is technically correct, that it reflects the current regulation, or crucially, that anyone actually follows it as written. And the interesting thing is that inspector knows this. The inspectors, they do not assess your signature page. They assess the entire life cycle of the document: how it's written, how people are trained, how it is executed, how the records prove execution, and how it is reviewed and kept current. And here is the finding that surprised the people most. The most common SOP observation is not a procedure missing. It is that there is no evidence that the approved procedure was actually followed. In other words, the document exists, it is beautiful, it is signed, there is nothing to demonstrate it was followed. The draft revision of EU GMP Chapter 4 on documentation makes this dual role explicit. A procedure is basically is both an instruction telling people what to do and a generator of the records that prove they did it. If a document cannot be executed exactly as written, it is a finding waiting to happen. So, where do these failures come from? Let's ground ourselves in the regulatory framework. So, let's anchor everything that follows in the guidelines, because when an inspector writes a finding, they cite a clause, basically. And so I will be showing you the same relevant clauses in this slide, basically. In the EU GMP Chapter 4, which governs documentation, it requires that procedure give clear instructions and generate records. A quick but most important note on the version control, which itself the theme of this webinar, is the current version of Chapter 4 is still the 2011 text, and a substantially rewritten draft was published for consultation in July 2025. The consultation closed in October 2025, and the final version is expected during 2026. So today in this webinar, we'll still talk about the 2011 version, as this is the current version, while flagging that a stricter revision is coming. And staying alert to that is exactly the kind of vigilance that keeps SOP inspection ready. So, point 2, the in the United States, we have FDA regulation 21 CFR 21100, and it requires the production and control procedures are written, followed, documented, and that any deviation is justified and recorded. The 211160 sets the same expectations for laboratory. Then we have 211192, which requires that every unexplained discrepancy is thoroughly investigated with a written record. Then in UK, where we are sitting at the moment, the MHRA Good Documentation Practice Data Integrity Guidance 2018 treats the SOP as a defined, controlled, and requires that the record it generates must meet the Alcoa Plus principles, and we will unpack this requirement shortly. Then we have WHO globally, the WHO technical reports, series 986 annex 2. This positions the documentation as foundation of the quality system. And finally, we have ICH-Q10, which reminds us that SOPs do not live in isolation. They sit inside a pharmaceutical quality system that is expected to manage them across the whole life cycle. One rule ties these together. Where the region differ, apply the most stringent requirement. That keeps you compliant everywhere at once. Now let's look at the very first and most common root cause. Okay, interesting slide. The root cause number 1 is the single biggest source of SOP finding, which is the practice procedure gap. So this is the difference between what the document says and what people actually doing. And if we look at the two columns, on the left is what SOP states, on the right is what inspector finds when they follow the process on the floor and interview people while they're performing that task. The SOP says, sorry, reconcile labels at the end of each batch. In practice, on the floor, it is done the next morning. So the question is still end of the batch? Secondly, the SOP says review the daily logs. In practice, the logs are reviewed weekly, and critically, there is no record of a daily check ever happening. Then we have a point where SOP specifies a step sequence of A, then B, then C. The operator does C, then A, then B, not following the sequence because it's faster and it no longer, um, um, but it's no longer matching the validated procedure, the sequence given in the procedure. Then we have a point where SOPs requires a second person to verify in the real time, usually is the senior supervisor check. But in practice, the verifier signs afterwards. So here is how inspector detected, and it is worth knowing they rarely start with the document. They actually start by watching the activity on the shop floor. I mean, on the production floor, or by asking operator to walk them through the task, and then they compare that against the SOP. The moment reality diverges from the text, you have either a procedure that is wrong or a practice that is non-compliant, and both are findings. The cross-functional lesson is universal. In quality control lab, it might be a testing sequence. In warehouse and good distribution practice, it might be a temperature check frequency. In pharmacovigilance, it might be a case processing timeline. Same gap, different departments. The fix is not to punish the operator. It is to make the SOP match validated reality, or to correct the practice through the retraining. Now, sometimes the gap is built into the wording itself. This is our root cause number 2. This root cause is more common than many people realize. Some SOPs are written to satisfy the reviewer rather than to help the operator perform the task correctly. On the left are examples of weak wordings, terms like periodically, regularly, as appropriate, if necessary, or in a timely manner. They sound reasonable, but they mean different things to different people. Even the word should suggest something optional rather than mandatory. The problem is that inspectors cannot objectively verify these statements. If an SOP says review periodically, how often is periodically? Once a day, once a month? Different people will interpret it differently, which means the process is no longer controlled. The solution is shown on the right hand side. Replace the vague words with clear, measurable requirement. Instead of periodically, specify every 24 hour, plus minus 2 hours if requires. When instead of as appropriate, define exactly when the action is required. Replace should with shall or must. Give clear deadline and reference the required SOP or training. Both MHRA and EU GMP4 expect a procedure to be clear, unambiguous, and capable of being followed consistently. And simple test is like if you ask two competent operators um, to read the same instruction and then ask them to perform, and if they perform differently while both believing they are compliant, then the SOP is not written well enough. So strong SOPs remove uncertainty. Strong SOPs improve consistency. They make the compliance easier. They are written to be executed, not just approved. Now, root cause number 3 moves from the procedure to the proof. An SOP is only as good as the records it generates. The regulator don't simply ask, do you have an SOP? The inspectors usually ask, can you prove the procedure was followed? Also, they assess those records against a set of principles called ALCOA++. Let me define them. ALCOA+ stands for, there is an additional plus here, but I'm going to show you the reason behind it. Attributable, you can tell who did it and when. Legible, you can read it. Contemporaneous, it was recorded at the time the activity happened, not later. Original, it is first capture of the data or verified to copy. Accurate, it is correct and error-free. Then you have plus, complete, consistent, enduring, available, and last plus is for the traceability. The draft EU GMP4, which is not active at the moment, is the draft EU GMP4 is notable for being the first guidance to formally codify this ALCOA+ set. Now, the common failures. We all know about the common failures, the backdated signatures, signing today for something done last week. It breaks the contemporaneous rule. Recording in pencil and then overwriting in pen breaks the original and accurate. A required check with no records breaks the complete and attributable rule. Using an uncontrolled form, a spare printout, a personal spreadsheet, it breaks the entire chain. And here is a phrase every inspector carries in their hat. If it's not recorded, it did not happen. When a required check is missing from the record, the SOP that demanded it stops. Your defense. And this SOP becomes the evidence against you because it proves you a required check missing from the record. You knew that the step was required, right? And you cannot show you did it. So these expectations come from the MHRA Data Integrity Guidance, FDA 21 CFR 194 on laboratory records, and the Chapter 4 UGMP Chapter 4 draft. So records, though, are created by people, which is the most important thing to consider. So we need to realize that these are the records which are created by people. Yeah. And this brings us to the root cause number 4. So root cause 4 is the human layer, the training and cross-functional disconnect. A perfectly written, perfectly recorded SOP still fails if the people executing it never effectively train on the current version. The first trap is the read and understood signature. Just ticking a box or signing an electronic form is not evidence that you are competent to perform a task. And inspectors probe this by asking the staff to demonstrate or to explain the procedure. And if the answer does not match the SOP, the training was not effective, isn't it? So the second trap is the version drift in training. The SOP was revised, but the training was never rolled out. Rolled out again. Um, so if the training never happened and the records show people train on an obsolete version, or sometimes the staff were trained once mm, at hiring stage and then never retrained when the procedure changed. So there are different scenarios. Sometimes you review the procedure, you make the procedure active, but no training was conducted, no training rolled out. Sometimes the training records are actually showing that people have never been trained. They are still trained on the obsoleted or superseded version. So that's the trap number two. The third trap is the cross-functional trap. And this is where the whole industry lives matter. A process almost never lives in one department. We all need to think the like a bigger picture at this moment. We have quality control, production, and the warehouse, sometimes supply chain, pharmacovigilance. Each of the department need their own SOP, and at the handoff, their interpretation do not line up. And contractor or agency staff who may be following a different procedure or none at all, the gap widens. Think about a scenario where you have an aseptic unit and you have outsourced it to the company who comes and the staff comes and they clean, and if you have revised the cleaning procedure but never involve or train the cleaning company, then it becomes a very high risk gap. So here is the concrete cross-functional example for you. A company revises its deviation handling SOP, shortens the notification timeline to regulatory departments or to the regulators. Now manufacturing is trained, pharmacovigilance is not trained, and it's suddenly a safety relevant deviation occurs. The old timeline followed and a reporting deadline is missed. This is a regulatory finding that began purely as a training distribution failure. So, how do we stop good SOPs from decaying over the time? This is the root cause number 5. So the root cause number 5 is about time. SOPs are living documents. The moment they are approved, the world around them begins to change. Equipment, materials, suppliers, staff, the regulation themselves. And if the document does not keep the pace, it drifts back into non-compliance. And here I have listed some failures. So the first failure is periodic review. Most quality systems require each SOP to be reviewed on a defined cycle. When that review is overdue or when it is done as a rubber stamp, where a signature with no genuine assessment of whether the procedure still reflects the reality, the control has failed. The second and the most damaging um, is the broken corrective and preventive action, or kappa loop. A deviation occurs, a kappa is raised, but the fix never feeds back into the SOP, so the same deviation happens again and again and again. This is very interesting because inspectors specifically look for repeated deviations, because a repeat tells them that the quality system, is not learning. The third is unmanaged change. A new machine of a reformulated material or regulatory update, like for example, the chapter 4 revision is coming. So that is not reflected in the procedure. And the fourth is the version control at the point of use. Is superseded SOP is still sitting in the folder or on the shop floor, being followed in good faith. ICH Q10 in EU GMP Chapter 1 required the single isolated, not isolated, but a single pharmaceutical quality system to drive the continual improvement that explicitly includes keeping procedure current and understand this escalation clearly. Because if a single isolated finding is manageable, a repeat finding or evidence that your review and kappa loops do not close will be treated as a systemic quality system failure, which is far more serious and trigger warning letters or worse. So let's make all the 5 causes concrete with a short example. So picture an SOP for environmental monitoring, since I'm an sterile expert. In a sterile finish filling area, on paper, we have an SOP which is perfect, drafted, reviewed, approved within its review date. Yeah. Then the inspection began, and we started receiving the findings. The finding number 1 is the SOP says samples are taken at the regular interval. Remember this weak phrase, regular intervals. Yeah. And the record shows gaps ranging from 3 to 10 days. So this is a weak language plus no evidence of controlled frequency. This is root causes 2 and 1 we discussed earlier. This is the combination of root causes 2 and 1. Finding number 2. The record contained 2 out of specification results with no investigation reports on the file. That directly breaks the FDA 21 CFR 211-192, which demands every discrepancy be investigated and recorded. This is root cause 3, the records not holding up. Then finding number 3, the inspector asked an operator to explain the method. It becomes clear they were trained on version 4 while the effective version is version 6. This is root cause for the training disconnect. Finding number 4 is the one that turns a bad day into a serious one. A previous Kappa had already identified the sampling problem, the recommended fixing the recommendation in the Kappa is fixing the SOP. But the SOP was never updated. This is root cause number 5, the loop that never closed. Now, look at the outcome. Once approved procedure generated a cluster of 4 linked observations, and because they are linked and one is a repeat, the inspector no longer sees isolated slips anymore. They see a systemic weakness in the quality system. This is exactly the escalation we want to avoid. So let's turn all of this into something you can act on. Here is the practical takeaway. A 6-part self-check you can apply to any critical SOP. I've tried to make a really interesting slide because here you can see you can verify that is your SOP compliant or okay, or have you got any issues? So first, walk it. Physically follow the task exactly as the SOP is written from start to finish. If you cannot, or if you find yourself doing steps in a different order or filling gaps from your memory, then you have found a practice procedure gap. Secondly, word tested. Scan for the weak words periodically as appropriate in a timely manner. Should every one of them gets replaced with a defined value, trigger, or deadline. Samples should be taken 48 hours at 9 o'clock on Monday, Wednesday, and Friday from defined location in Appendix, say 1. Now, number 3, evidence tested. Go step by step and ask, does this step create a record? Does this record meet Alcoa Plus? Is this attributable, contemporaneous, complete? If a required action leaves no trace, you cannot prove it happened. Then it comes to 4th, train tested. Confirm that everyone who uses the SOP, including contractors, and even function in the handoff, is trained on the current version. Then go further. Ask them to explain it in their own words. This is exactly what the inspector will do. 5th, currency test. Currency tested. Is it within the review date? And do any open deviations, kappas, or regulatory changes mean it already needs revising? So you have to have a look at your action logs, at your change logs. Then 5th, 6th is the version tested. Make sure only the effective version exists as the point of use and that the superseded copies have been removed. Do this proactively on your most critical procedures first, and you convert inspection from an audit of surprises into confirmation of what you already know. Now, let's consolidate the key messages. Here I'm pulling all the threads together. 6 messages to carry away. 1, approval does not equal compliance. An approved SOP only proves it went through your process. Inspector assess whether it is executed and whether the evidence exists. Do remember in the five root causes, because almost every SOP finding is one of them. The practice procedure gaps, weak and unforeseeable languages, records that do not hold up, the training and cross-functional disconnect, and the life cycle loops that never closes. Three key message is internalize the phrase: if it is not recorded, it did not happen. And design Alcoa Plus evidence into every single step that matters rather than bolting it on afterwards. Fourth, write your procedures for execution, not for approval. Define intervals, define triggers, hard deadlines, and the word shall and must instead of should. Five, the fifth takeaway is close the loop. Periodic review and kappa only protect you if their conclusions actually flow back into the procedure and the training. Sorry, got a really bad cold. And sixth, the one that carries the most weight with the regulators, repeat findings are read as systemic quality system failure. They cost far more in remediation, in trust, in regulatory action than any isolated observation. So let's focus on these takeaways and make sure you use the checklist I produced while you're writing any standard operating procedure, work instructions, preparing any control forms, logs. It applies to all the control documentation, not just the SOPs. So thank you so much for today. Remember the key messages: do not write SOPs to pass the inspection. Write them to be followed. Do not create records to satisfy the auditors. Create records that can prove quality, consistency, Alcoa Plus. Don't blame people, improve the system. Because inspection readiness is not an event, it's a culture you build in every culture you build every single day. Thank you for attending this webinar. I'll see you in the next Academy of Pharmaceutical Excellence webinar. Take good care of yourself and goodbye.